Hi, thanks for visiting caregiverrelief.com. Our website is for caregivers. We know that being a caregiver can be challenging, but we are here to help. Our website is full of useful information that can make your life easier. If you want to stay up to date with our latest content, be sure to subscribe to our email list. And as a subscriber, you'll get access to exclusive content that isn't available to the public. And don't miss out on all the great resources we have to offer. Subscribe now and start benefiting from our expert advice and support. We look forward to supporting you on your caregiving journey. Today, we are going to talk about what are the 7 stages of dementia. Even though dementia is often associated with the elderly, it's important to remember that this severe disorder is not part of the normal aging process. In fact, according to the National Institute on Aging, NIA, around 1/3 of all adults over the age of 85 years old are likely struggling with some form of dementia. This condition can start for different reasons, from Alzheimer's disease and Parkinson's disease, all the way through Lewy body dementia and frontotemporal dementia. Dementia progress can be gradual in stages, ranging from early stage advancing to late stage dementia. Some people with dementia will advance in the dementia stages gradually, like stair steps. Others will progress rapidly through the 7 stages of dementia. Many ask, what is the life expectancy after getting a diagnosis? There's no way to determine the exact life expectancy. Some put the average at about 4 to 8 years after diagnosis. But I can tell you there are types of dementia out there that a person can live with as long as 20 years after diagnosis. And I'm seeing that all the time. Most people do not know that brain changes start as early as 10 years prior to an official diagnosis. So they are developing dementia, and dementia signs and symptoms are very subtle in what we call the early stages of dementia. Dementia is an umbrella term used to describe a wide range of neurological conditions that affect someone's ability to think, remember, and reason. It can impact individuals in different ways, from mild changes such as occasional forgetfulness or personality shifts through the most severe stages when cognitive skills severely decline. The majority of cases are caused by Alzheimer's disease, whereas other factors which may trigger dementia include vascular issues or abnormal protein buildup in the brain known as Lewy body dementia. Understanding its associated signs and symptoms remains paramount for early intervention strategies. Because there are so many different types of dementia, I want to address few of the different types because the early stages of each can be different. As the dementia progresses, the brain cells start to die off. Symptoms affecting memory loss and physical abilities will affect everyday tasks. By the middle stages of dementia, a person will experience the similar signs and symptoms through the dementia stages. So I'm going to briefly explain these conditions here. I have developed dementia-specific audio casts in the Caregiver Release Library. So let's talk about Alzheimer's disease first. Alzheimer's disease is the leading cause of dementia, accounting for an estimated 60 to 80% of the cases. Although its exact origin remains a mystery, research suggests it could be attributed to abnormal protein clumps and threads in the brain, which causes damage that leads to shrinkage of the brain over time. These proteins are called amyloid plaques and tangles, and these plaques and tangles cause brain cells to die and the brain shrinks. Alzheimer's disease, also known as AD, is a type of progressive brain disorder that can affect thinking, memory, and language. It is most commonly seen in people over the age of 60. It first involves the parts of the brain that control thought, memory, and language. So, in the early stages or in the beginning stages, a person with Alzheimer's disease may have trouble remembering things or what happened recently or the names of people that are familiar to them. I want to make you aware of a condition called mild cognitive impairment, also called MCI. This causes more memory problems than usual for older adults. This is a condition that allows the individual with MCI to continue to be able to perform everyday tasks. It can advance into Alzheimer's disease, but not all people with MCI will develop AD. Common types of dementia include vascular dementia. This dementia is caused by restricted blood flow to the brain due to blocked, narrowed, or damaged vessels, often resulting from stroke or other trauma. The blockages commonly occur as a result of a stroke or a traumatic brain injury. Individuals that have high blood pressure may start with having mini strokes, also known as TIAs, transient ischemic attacks. Causing vascular dementia can also happen gradually. Limited oxygen supply can cause reasoning and memory problems, leading to further deterioration in cognitive abilities over time. And that's what happens with the smaller transient ischemic attacks. So let's talk about Lewy body dementia, or LBD. Lewy bodies are a type of protein that can grow in abnormal amounts in the nerve cells of the brain. It can cause difficulty with movement and thinking. Those affected may experience trembling, a decrease in muscle control, and an inability to process information quickly or accurately. The point I want to make is that it's different from other types of dementia in the beginning stages because LBD affects information processing rather than memory. LBD is the most misdiagnosed dementia. This is because the symptoms of Lewy body often are symptoms similar to other mental health disorders. And to make matters worse, the causes of LBD remain unknown today, making effective treatments difficult. Right now, health professionals are focused solely on managing symptoms rather than curing them. Another type of dementia is frontotemporal dementia. This is an uncommon type of dementia, and frontotemporal dementia affects younger people between the ages of 45 and 65. It's caused by a buildup of abnormal proteins in two parts of the brain, the frontal and the temporal lobes. These regions of the brain control language, behavior, and personality. People living with this type often have language skills affected. They will also experience mood swings and changes in their behavior. I want to make you aware there is a condition called mixed dementia. Mixed dementia is an umbrella term that encompasses several different forms of brain diseases, with Alzheimer's disease and vascular dementia being two of the most common types of dementia that may occur together. Another combination that has been found is the combination of Alzheimer's disease and dementia with Lewy bodies. There have been autopsies done on individuals that suffer from dementia, and there have been cases that have had a form of mixed dementia that includes Alzheimer's disease, LBD, and vascular dementia. So as you can see, dementia is a complex condition with many unique experiences that depend on the individual. No two cases of dementia are ever the same, but it does share common characteristic as the disease progresses. The Reisberg scale outlines 7 distinct stages of dementia based upon how much cognitive decline has taken place. The first stage of dementia, initially, there is no signs at all. It is called the normal stage of dementia. Stages 1 through 3 of dementia progression are generally known as pre-dementia stages. In stage 1, there is no cognitive decline that is able to be detected. It is now believed that individuals that develop Alzheimer's or LBD may be experiencing subtle brain changes as early as 10 years before dementia symptoms exhibit themselves. Some subtle changes to occur may be lethargy and a change in interest in life and those around them. I have had family caregivers tell me that they had a family member notice the change over time and how that impacted how they view their family member with dementia. The personality changes that occur in the very early stages negatively impacted family relationships. This is especially true of LBD, as it is often misdiagnosed as a mental health disorder. So, if you want to learn more about the very early signs of dementia, take time to listen to my audiocast on that topic in my library. I want to make you aware of several dementia related disorders or illnesses that will have no cognitive decline in the early stages of dementia. Individuals that have been diagnosed with normal pressure hydrocephalus, or someone diagnosed with multiple sclerosis and Huntington's disease may develop dementia like symptoms as their disease progresses. Now, the second stages of dementia is known as the very cognitive impairment stage. In this early stage, there is very mild cognitive decline. While still sharp on most days, it is one of the earliest signs. In this stage of dementia, the person starts to experience occasional memory loss, such as forgetting where they put a familiar object, or having difficulty remembering recent events, or forgetting names they once knew very well. In the early stage of dementia, the dementia symptoms are unlikely to impact a person's work or social interactions. In fact, the symptoms may be even too mild to detect in an interview by your healthcare team, as the person with mild impairment may be able to adequately perform well on memory tests during the interview. This is when your healthcare provider will do or should do a mini mental status exam. Please understand me that a mini mental status exam, SE, requires a baseline test. And I feel that everyone should have a mini mental status exam in their early 60s so that changes can be detected. And I also recommend that you ask your provider to perform a St. Louis University's mental status exam, the SLUMS test, SLUMS. This is a test that is able to detect minor or more subtle changes in your thinking processes. I've had so many clients tell me that they went to their doctor and have even been to a neurologist to be told they are fine. They did well on the mini mental status exam. That was their baseline, so it didn't even count. It was just a baseline. Our medical delivery system is broken. If you are under Medicare, doctors are allowed a 15-minute appointment. And this is not enough time for a doctor to do a comprehensive mental status evaluation. When I heard that they did not do anything to rule out reversible, I recently had a neighbor have come to me. She went to the doctors, her primary care for doctor, and he referred her to a neurologist to have, because she has a history of in her family, and she's starting to have in her late 70s some cognitive issues, and she's concerned. So she came to me because she was so frustrated, because what happened to her was she went to them, they did the mini mental, they didn't do the slums, and they told her she was fine. And I'll share more of it there. What frustrated me was they did not even do any tests to rule out reversible dementias. So I really understood her frustration, because I told her, you need to have these tests done. And the thing is, you need to have your vitamin B and D and magnesium checked. Anyway, everything we told and hear from the healthcare providers is early treatment is important to improve quality of life for a longer period of time. In mild Alzheimer's disease, lifestyle changes, medications, and even playing games can delay the progression to develop Alzheimer's disease into the advanced stages of dementia. When my neighbor came to me because she has high risk factors for a family history of dementia, and she was clearly having some problems with memory loss, she was upset and scared. And I was just frustrated and angry with the medical delivery system. So I made my client aware, or my neighbor aware, of the Quest AD Detect program. And it's not presently approved by the FDA, so therefore Medicare will not cover the test, but you can actually call Quest Diagnostics for the test. And this is one of 2 blood tests on the market to detect amyloid levels in the blood and diagnose dementia. The other test was for like over $1,200, but for cost purposes, I recommended that the Quest AD Detect test. It was $500 for this test. And my client at this point didn't care. Peace of mind was important to her. And early diagnosis will allow us to make a plan to slow the decline as the disease process progresses, to help us assess whether patients exhibiting signs of mild cognitive impairment or dementia may have AD Quest Diagnostics offer the Quest AD Detect test. It's a beta amyloid test, and this is a simple blood test that provides a simpler option than PET scanning and PET imaging and less invasive than cerebral spinal fluid sampling. And doctors are all about, and our healthcare system's all about saving money. That's why they delay so much testing. My neighbor received her results, and she did have a higher than average amount of beta amyloid plaques. She was able to take her test and results back to the neurologist and her PCP to show them that they were wrong. We worked to start a program to delay the progression of the disease. And it's ironic because once you diagnose dementia, the doctors will believe you and work to prescribe meds. And I'm presently working with my client on how to slow the progression of the disease through games and physical activity. Stage 3 of dementia is called the mild cognitive impairment, and it is characterized by noticeable impairment in short-term memory and cognition, from getting lost easily or forgetting names to difficulty retaining information read or concentrating on tasks. After I have been working with clients over the years, I am just frustrated with our medical delivery system. I cannot tell you how many times I've called geriatrician's office and even neurologist's office and asked them would they do a comprehensive dementia testing. Most of them Most tell me that the initial test is doing the mini mental status exam. Again, this test needs a baseline. So when a person in stage 3 of dementia can and most likely will be told they are fine and don't have anything to worry about, common symptoms of dementia at this stage start to interfere in normal activities of daily living. A person may experience getting lost while walking or driving, particularly in unfamiliar places, reading something and retaining very little of it, forgetting the names of people they just met, losing items or misplacing items, having trouble concentrating and performing complex tasks, performing poorly at work to the extent that it becomes evident to the colleagues. With proper diagnosis at this stage, patients can learn helpful coping strategies and put plans in motion that will aid them in worrying less as their symptoms become increasingly disruptive day-to-day life concerns. If you are struggling to get a dementia diagnosis, I encourage getting the blood tests. For those that can't afford to get the blood test, take the various dementia tests you can find on Caregiver Relief. There are many different tests like the clock drawing, animal naming, as well as the mini mental status exam and SLUMS test. Take these tests and record all of your results and take those results to your healthcare provider to get an accurate and early diagnosis. At this stage, a person may start to be aware and start feeling anxious as their symptoms start to become apparent and interfere with their ability to perform routine tasks. Now we're going to talk about the middle stage of dementia. At stage 4 of cognitive decline is still considered mild dementia stage. A person's dementia symptoms may become more apparent and noticeable than before. They may find it difficult to concentrate on complex tasks or remember events that occurred recently. Socializing with friends and family can also be affected as people withdraw from situations due to their heightened difficulties. Some of the symptoms of this stage may include lack of knowledge of current or recent events, difficulty remembering parts of their personal history, trouble with organizing, planning, traveling, and managing finances, definitely difficulty with problem solving. Physicians will typically detect signs of dementia at this stage through clinical evaluations. In stage 4 dementia, typically individuals have no trouble recognizing familiar faces or traveling to familiar locations. However, persons in this stage will often avoid challenging situations in order to hide symptoms or prevent stress or anxiety. At stage 5, it is still considered middle stage or mild dementia. They still may struggle to remember major details, such as close family members' names or home address. They can become disoriented regarding to time and place while having difficulty with decision-making processes. Additionally, they might not recall basic facts about themselves, like their own phone number or address. However, this level of dementia does not interfere with essential tasks, including using the room and feeding oneself. They may need help to decide what to wear, and because they may want to wear winter clothes in the middle of summer. Difficulty counting backwards from 20 by twos or from 40s by four, provided they are educated and once were able to do this calculation, is a problem for them. They do have trouble with problem solving. While patients will generally still know who they are and able to recognize spouses and children's names, people living with dementia in this stage require some support for everyday activities. Now, let's talk about stage 6 of dementia. And this will require this at this stage, a person's going to require full-time care as they have difficulty remembering even the names of their closest family members. Observe for signs such as delusional behavior, obsessive compulsive compulsions and symptoms, anxiety or aggression, paranoia, and even hallucinations. The loss of willpower occurs due to being unable to carry a thought long enough to complete the action. The person living with dementia may start having to have wandering tendencies and start sundowning as they have increased sleep disturbances. Other dementia symptoms include difficulty communicating at this middle stage of dementia. As dementia progresses, more than just short-term memory can be affected. Not only may those with moderate dementia struggle to remember past events, they often experience drastic changes in personality and behaviors, feeling distrustful or anxious, even around people who are familiar faces in their daily routine. Caregivers should seek professional help if there is a sudden increase in these behaviors or indicators that would indicate further deterioration of other health conditions. An example of this is a sudden increase in confusions or in combative behaviors may simply be something as, I know it doesn't sound simple, but a urinary tract infection. And they can go undetected for a long time in seniors, causing them to become really ill. So definitely, even in the later stages of dementia, an increase in confusion or aggressiveness in behavior, you might want to consider checking out and seeing if they have a urinary tract infection. As dementia progresses to its seventh and final stage, those affected experience severe decline in cognitive status and have increased difficulty communicating. Physical changes occur, such as the inability to walk without help. The average duration of this late stage dementia is 2.5 years, during which time people with severe dementia may require full-time assistance from friends and family members and become prone to infections like pneumonia. Though it can be heartbreaking for caregivers watching their loved ones reach this difficult point, In life's journey, providing patience, love, and support makes all the difference for those whose lives are touched by extreme mental decline brought on by age or illness. Living with dementia can be difficult and unpredictable. Being informed is the key to better navigating the disease progression. With in depth knowledge on how it develops, you'll have a much clearer idea of what precautions need to be taken and ways that you can potentially slow its effect.
Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below.